Hi, this is Niniola, and you're watching Adexi TV.
Hey everyone, my name is Dr. Adex Omotola, and in this video I'm going to be talking about diarrhea fault. I'm sure some of you have heard about diarrhea fault, probably even used it, and there are definitely some people that haven't heard about it. Diarrhea fault is actually a supplement that contains balanced amount of 25 vitamins and essential minerals fortified with ginseng. And I'm sure some of you are like, why is it different from any other type of supplement? Diarrhea Forte comes in two packages, which is the 50 capsules and the 30 capsules. So what this drug does for you is that it helps to balance all your basic needs of the body, and it increases general vitality. So each of these diarrhea capsule actually contains 12 vitamin and essential minerals, which is broken down into 25, as I told you guys in the beginning, which are ginseng, which is actually from the root extract of Panax, aloe vera, Barbados aloes, lecithin, biotin, chromium, selenium, iron, zinc, calcium, lysine. What are these vitamins? What are these minerals? Like, what do they do exactly? Why do I need to spend my money on derived for? What ginseng actually does is it helps to improve your thinking, your concentration, it helps with your memory, it helps with depression, work efficiency, physical stamina, athletic endurance, anxiety, chronic fatigue, gastritis, fever, hangover, COPD, and asthma. Second composition is aloe vera, which is also called Barbados aloes. It helps with digestion, is anti-inflammatory, it purifies blood, stimulates liver and spleen for proper activity, helps with other urinary related problems, skin related problems, worm infection, it decreases general body weakness. So the third composition, which is lecithin, helps with memory disorder, skin disease, liver disease, and gallbladder disease. For more information, I would advise you to go through the leaflets or go online to check on diarrhea fault and the uses, what it actually does. I'm just going to browse through each and every composition. I'm just going to say 2 or 3 things, and the rest you can find it on their website. The fourth composition you find on diarrhea fault capsule is biotin. Yes, biotin. I know a lot of you know what biotin is for. It's for hair loss, it's for nails, people that have short nails like mine, and for glowing skin like mine as well, you see, for skin rashes. Now, chromium is a nutritional supplement. It helps the cell to process glucose more effectively. It decreases the rate of heart disease. It's selenium. It actually improves your immune system, like at this period of pandemic and everything. And finally, it helps to fight cancer by boosting your antioxidant activities. Iron, which helps in producing more red blood cells. The next composition is zinc, which helps with boosting the immune system, treating of common cold and ear infection, wound healing, prevents lower respiratory infection, and it's used for disease caused by parasites. We all know what calcium is used for. It's used for strong bones, teeth, also for your heart, your nerves as well. And it helps to reduce the risk of osteoporosis, the condition of when your bones start getting soft. And it helps to reduce the risk of colon and rectal cancer. And the most important part of this calcium is it helps with premenstrual syndrome, PMS, that's called PMS, and leg cramps in pregnancy. Lysine. So lysine helps to increase muscle mass for my men out there, my gymnastics out there. It also helps with herpes infection. It helps to treat pain, improve anxiety, and helps with migraine. So far so good. We've spoken about 10 composition of diarrhea fault capsule, and the remaining 2 here is the vitamin and the minerals. So those 2 are actually broken down to a lot. Vitamins like vitamin A, vitamin B, vitamin B2, B12, B6, D3, vitamin E, folic acid, nicotinamide, copper, potassium, magnesium, calcium. Honestly, Daravite does a lot of things, a lot of things, because it's a supplement. I hope this video was broken down enough for you guys to really understand what this capsule is made of and the importance of this capsule as well. The difference between Daravite Forte and Daravite Woman is that Daravite Woman is actually specified for women only. Young women, women in their premenopause stage, women in their menopause stage already. That's what it is used for. Daravite Woman is a combo pack of multivitamin with chasteberry extract, evening primrose oil, biotin, antioxidants, and other type of mineral. So why this is different from Daravite Forte is that this has 4 extra composition. When you open this pack, you see that each combo pack contains product A and B. For product A, you take 1 soft gel daily on regular days, and for product A and B, this is for the monthly cycle. You start taking both the soft gel 1 to 2 days prior to monthly cycle and continue for 5 days. So I'll put a video on the screen so you guys can see properly. And on this soft gel, they are actually labeled already for you. You see the day 1. They're actually labeled already from day 1 to day 23 on the regular day soft gel. And on the monthly cycle soft gel, you see day 1 to day 7. The product A contains most of the components or most of the composition, so you can easily understand because we're just going directly to the B. The extra composition for this capsule or this soft gel is chasteberry extract, evening primrose oil, lycopene, and citrus bioflavonoids. Chasteberry extract is actually a herb with a long history of use, specifically for women fertility and the hormones. For the evening primrose oil, it actually helps with PMS, which is the premenstrual syndrome. It helps with breast pain, eczema. It also helps for the menopausal symptoms, endometriosis, and is a source for essential fatty acids. Lycopene helps to prevent ovarian cancer. And lastly, for the extra composition in this soft gel is the citrus bioflavonoids, which is actually high in vitamin C. Promotes healthy circulation. It helps with immunity, actually boosts the immune system, and helps with the joints. Provides energy and vitality, promotes anti-aging and glowing skin, supports healthy reproductive system, regulates monthly cycle, and strengthens your immunity. So don't you think we women need this? We need this. This is actually very important, honestly, so you stop running up and down when something complicated happens. Get this so you start using it right now, so you won't come running to doctors at the end of the day for this and that and this and that. One Daravite Woman soft gel a day keeps the doctor away. I think that's the end of this video. If you're interested in this capsule, my Facebook and my Instagram handle will be down in my description below, so just DM me if you're interested. This capsule can actually be sent to any state within Nigeria. That's all for Daravite Woman soft gel. I hope you enjoyed this video, and if you do, please do well to click on the like button, subscribe to this channel down there, click on the notification button to get notified every single time I post a video. Drop your comments and tell me, guys, if you really want me to keep doing videos like this, yes or no, because this was really interesting and I really loved it. Thank you to Daravite Forte for letting me do this video. I really appreciate it. See you next time. Bye.
Hi, this is Niniola, and you're watching Adexi TV.
Hi beautiful people, welcome to my YouTube channel. This is Dr. Adex Omotola, and in this video I'm going to be telling you or explaining to you the drugs, the fruits and foods you should avoid when you have stomach ulcer. So before we just jump into this video and I start telling you this and stuff that, I just want to explain to you what ulcer is in the first place. Ulcers are sores that develop in the lining of the stomach or in the esophagus or in the small intestine. So you need to know that there are 3 types of ulcer. You have the gastric, you have the duodenal, and you have the esophageal ulcer. So that being said, let me just jump right into the type of food, the fruits, and the drugs you should not take as an ulcer patient. So if this is the first time of you being on my channel, you are welcome. If this is not your first time, welcome back. Make sure you click on the subscribe button down there, like this video, subscribe, share to your friends, your family, your bae, and your boos. Make sure you grab a pen or a pencil to write down all this food, or you just wait to the end of this video and screenshot the list at the end of this video, okay? So the first type of food you should avoid as an ulcer patient, or if you have stomach ulcer, is gari. I'm sorry for saying gari. It is actually called cassava flakes. Cassava flakes or gari is the same thing. Any type of food that you have cassava in it, you need to avoid it. And we get a lot of patients that are like, I can't stop gari. Gari is my best food. But please, you have to, because you don't want to aggravate your ulcer. People don't know that ulcer can be really, really complicated if it's mismanaged or if you just worsen it. So please stop gari. And the elbow is actually called the cassava flour. So avoid anything with cassava in it, please. Second thing you need to avoid, this stuff has been abused for the couple of months that we've gone through because of this coronavirus. I don't know why I'm doing like this, but it's coronavirus. Because of this coronavirus that we had in Nigeria, most people, they've abused the use of garlic, turmeric, and ginger, thinking that it's going to just all of a sudden clear the coronavirus that you have. But those things are spices, and spices add to the acid in your stomach. Your stomach is already secreting acid already. Then you take these things in, and what? You're causing more problem for yourself. So garlic, turmeric, ginger, all these things. Some patients even combine these 3 things and drink morning, afternoon, and night because they don't want coronavirus. I don't know why some people are passing wrong information out there. And there's a woman that will go in the hospital, she's like, no, she doesn't take garlic or turmeric. What she takes is chalk, fermented chalk. And we're like, and you're not a patient, you're drinking fermented chalk every morning. Please, when stuff is already fermented, it's already acidic. So it's like there's no difference between the garlic and turmeric and the ginger. So please, guys, I know some people really love ginger and turmeric and all of that, but you need to minimize the way you take these things, because they are spices. They're not meant to just be for you to just be drinking. No, please. That thing is even the highest of them all in Nigeria presently. A lot of people are abusing the use of garlic, turmeric, and ginger just because of coronavirus. Fatty and fried foods. And when I'm talking about fried food, I also mean fried rice, jollof rice, egusi. Egusi is a lot of oil. As an ulcer patient, you don't need to take egusi, please, because egusi is melon. Melon is oil. Like, do you know that processing thing is the same thing? So please, egusi, fried rice, jollof. You can make concoction. Yeah, you can make concoction, but anything with those spicy pepper thing, avoid. You don't need all of those things because they are not good for you. You are just going to make your ulcer worse. You don't want to start vomiting blood or something like that, because ulcer has killed a lot of people. All right, lest I forget, while we're still on the topic of spices, curry and thyme is also added to the garlic, turmeric, and ginger. So yes, curry, thyme, garlic, ginger, turmeric, 5 things under spices. Then let's go to the fatty foods: fried rice, jollof rice, your akara, anything that is fried, stew as well. And if you want to make some type of food, because some people are really used to chopping their onions on the food that they are going to cook. You need to stop that. You don't need to slice, because the moment you slice it, it's already a spice already. So it's better for you to blend into your pepper or whatever before you make. No slicing of onions on top of your food, please. Okay. Under the things that are fried, I know a lot of us are used to taking junks, because we get some patients that are like, I don't eat food from outside, I don't eat spicy food, I don't eat this, that, but you eat fatty foods. You eat pop-off whenever you get a chance to. You eat egg roll, you eat akara, you eat what's fried plantain. All those things as well are going to aggravate your ulcer. So no fried foods. No, say no to fried foods. Acidic food or fruits. So the first thing you should avoid under acidic food is beans. You need to stop eating beans. Okay, wait. I know you guys are like, what? Beans? Okay, no. You just need to peel off the shaft of the beans, because that is acidic. So I know it's stressful sometimes, but trust me, it's really, really nice, because we worry people like eating beans that is peeled, and it's really nice. So just be like us for the meantime, for the sauce to heal up, then you can go back to the type of food I eat before. So peel the shaft off your beans before cooking. Yes. Next thing are fruits, acidic fruits. You have apple, pineapple, lemon, and orange. Apple, pineapple, lemon, and orange. Those 4 fruits are really, really, really acidic, and you don't need to eat those fruits when you have stomach ulcers. Yes, I know you guys said that behind me. Foods that contain caffeine or coffee, like coffee, obviously. And you need to stop drinking Pepsi. You can drink Fanta, but the best drink I would advise you to take is malt, Amstel malt. Those are your best friends for now. Don't take Pepsi, don't take Fanta. Everything is for your own good. I know that I've been saying a lot of things for you to avoid. I know it's not easy, but isn't it better for you to take care of yourself now than going for surgery or the ulcer getting complicated? So just take care of yourself now. All these things are very easy. You can get something else to take over those things, to substitute for those things. Am I making sense? You can get something else to substitute for those things than making it worse. My bad. Orobo is called bitter cola, cola nuts, Pepsi, coffee, and tea bag like Lipton, green tea, top tea, black tea, like literally any tea. That's why when you want to get all those teas, you need to check at the back. Does it have caffeine? Yes or no? You need to check as well, because you need to know what you're taking in your body. You need to check after yourself. You need to monitor what you take in. But honestly, some of these teas are not going to tell you that there's caffeine inside and there's caffeine in it. So just avoid any type of tea bags. The best tea for you to drink as an ulcer the best tea for you to drink as an ulcer patient is Ovaltine. The other thing that has caffeine, that has a lot of caffeine in it, are energy drinks, right? You guys, you take them and you get so energized. You should know that it's caffeine that is in those things. So all your Lucozade boost, all your energy boosters, there's one particular one that I don't really like the smell. Almost all the energy drinks, the smells are really bad. So I personally don't like energy drinks from the beginning. So energy drinks, you need to stop them as well. The next thing you need to avoid, and I know you guys are going to kill me for this, but I'm helping you. Like, if I don't take care of you, who will? Chocolate is a no. No. It will irritate your stomach lining. So no more chocolate, please. Let me sit down for this, because this next one this next one is even a no. And I know a lot of you guys like to take this because like it's a first aid to we Africans, and it's what? Agbo. If you guys are watching me, I don't know what agbo means. It actually means about mixture. Oroki aba mixture. Those herbal mixture that they mix by the side of the road and they hawk and they sell, no, because most of those mixtures are already concentrated before they give it to you to drink. So as I said before from the beginning, you don't need anything fermented, you don't need anything concentrated, because of your stomach acidity. It's going to worsen it. Some of these things are good, but when it is concentrated, when it is fermented, you don't need to take those things. So no more agbo, no more concentrated fermented agbo. So the last but not the least for you guys to avoid as an ulcer patient, or if you have stomach ulcer, are some pain meds like aspirin, ibuprofen, diclofenac. I know these things are being abused in Nigeria. I don't know, I can't speak for other African countries, but you go to the pharmacy, you say you have headache, and immediately within seconds the guy already gives you diclofenac without asking you if you are an ulcer patient, or without asking any questions, honestly. And they give you all these drugs and you use them over time. You use them and use and use, and those things actually develop ulcer for you. So now that you already have it, just make sure you stop diclofenac, because these medicines are really strong for pain relievers. Like, they are really strong pain reliever meds. So just stop it. It's not good. This drug I'm about to mention right now contains a lot of caffeine, because we have Panadol, which is just okay, and you have Panadol extra, which like literally is like the extra of the Panadol. And why is it extra? It's extra because of the caffeine. So no more Panadol extra, no more diclofenac, no more ibuprofen, no more aspirin. At this point of your life, honestly, Panadol is paracetamol is your best friend. Paracetamol and you are like lovers. You guys are like together. So paracetamol is your best meds right now. No extra painkiller meds. If you are feeling pain, just go to the hospital. There's no need for you to self-diagnose yourself or just start swallowing a bunch of drugs that you really don't know what it can do to you. All this fruit juice like Five Alive and the rest, all this citrus juice, you need to stop taking them as well. It's just better for you to make your own smoothie at home. Like, just blend all the natural fruits together and drink, because you don't really know. They say it's natural. I don't believe it's natural, because there are a lot of other things they're going to put in there to make it packaged, to make it nice. So if you want to take any fruit juice, I would advise you to make it at home by yourself. Blend your juice, drink it. You would feel really good, because you know that you know what these things, you know where they are coming from. You blended them yourself. So no more citric juice. Blend your fruit juice at home. You can only take malt and ask them water. It's the same thing. When we talk about ulcer, you immediately think peppery food, spicy food. Yes. When you have ulcer, you don't need to take spicy food. No more extra pepper, no more extra atarudu, no more extra tatache or anything like that. The next thing you need to avoid when you have stomach ulcer is alcohol. You need to avoid alcohol as much as possible. I don't know how much I can emphasize on alcohol. No more alcohol. Alcohol is cancelled. Those are the list of food you should avoid when you have stomach ulcer. I know it's a bunch of food, like the list, I think it's like 27 or 28 food you should stop, but it's for your own good, as I said in the beginning, not to aggravate your ulcer. Those are the type of foods you should avoid as someone that already has stomach ulcer. And I hope I was able to help you guys with this video. I really tried my best to put everything in there and not to miss a thing. And I'm glad you guys stayed to the end to watch this video. Don't forget to like, subscribe, share to your family, your bae, your boo. And see you in my next video. Bye. All those things. to the bin. Get it from someone that actually have sense. I'm sorry, because most people are like, so if you go to party now, we're not going to be able to eat. I'm always wondering, like, people just like, there's nothing to eat anymore. There's nothing to eat anymore. There are lots of things to eat. Jump on it, jump on it, jump on it. If you want it, let's do it. Ride it, my pony, my saddle, stay, coming, jump on it. If you want it, let's do it. Ride it, my pony, my saddle is waiting. As an ulcer patient, don't you get tired of being confused on what to eat? Always selecting food, seeing your best food right in front of you, but you know that you dare not try it. Always confused on what to avoid and what to eat. Trust me, I know the struggle, and that's why I'll be talking about the types of food to consume as an ulcer patient, and also the fastest way to heal an ulcer. That's going to be at the end of this video. Hi everyone, my name is Adex Omotola, or you can call me Adexi for short. I'm a medical doctor and a surgeon, and this page is basically about lifestyle in general. We all understand what ulcer is and what H. pylori is, and I'm sure that I've passed enough information. Let's now go to the food, the main reason of this video, the type of food that you can eat so you don't get confused. If you watched my last video, I'm just gonna narrow it down, right? I talked about not eating fried foods, right? So the opposite of that is boiled food. For example, your meat has to be boiled. You don't have to fry your meat. Your fish has to be boiled. Your egg, instead of you frying your eggs, you have to boil your eggs. Everything now is boiled, not fried. Do you understand me? It's talked about not eating fried rice, jollof rice, because most people are like, so if you go to party now, we're not going to be able to eat. When you're at home, instead of making jollof rice, because you're not even have to fry the stew before you make the jollof rice, concussion is the best for an ulcer patient. I also mentioned spices. If I could remember, I mentioned spices like your curry, your thyme, ginger, turmeric, garlic, all those things to the bin. Sorry, I'm too mean, but all those things to the bin. You don't need them right now. I also mentioned not chopping your onions on your food, because onions are spices. If you don't know, I think some of you know, but if you don't know now, you know. Instead of you to chop your onions on your beans, on your rice, any way you chop your onions, anything you chop your onions on, you could just blend them, because the moment you slice the onion on whatever, it's a spice. You understand? So the spice is already in the food. Just blend the onions with your pepper and mix it all together. You don't have to chop your onions on food anymore as an ulcer patient. Raw honey. You have to take raw honey because it actually helps a lot, raw honey. If you're not sure that the honey, because I stay in Lagos and there are different types of honey. If you're not sure that this honey is the original type, don't get it. And if you're diabetic as well, just avoid the honey. If you know that you can get raw honey, the ones from the village, you can get it and use honey. Fruits now, fruits and vegetables, banana, watermelon, coconut water, and you have to exclude all type of citric fruits. I'll put a picture on the screen of all the type of citrus fruit you should avoid, like apple, lemon, pineapple. I think you guys should know that are a little bit acidic, and alkaline and stuff like that. I'll put them on the screen so you know that you should avoid those type of fruit. For vegetables, I feel like you can never go wrong with vegetables. Vegetables don't have any issue, So when people, I'm always wondering, people just like, there's nothing to eat anymore. There's nothing to eat anymore. Oh, you want us to starve? Oh no, I don't eat like before. These vegetables, I've literally listed a lot of things already for you to eat instead. And avocado or pear is actually very, very good for ulcer patients. That's one of the things that you should actually take note of. I mentioned that if instead of drinking Pepsi, Fanta, and all this stuff, just take malt. Malt is like your best friend. Your tea bags, your top tea, your Lipton, your green tea, your yellow tea, your brown tea, them, all the teas, because there's caffeine in all these things. That's why. But there are some, like the imported ones, right? When you check the pack and you see that there's no caffeine in it, then you can go ahead to get those ones. Just make sure that there's no caffeine in those things, because when there's caffeine in it, you're just making it worse. You can take Ovaltine. Ovaltine is like the best type of drink an ulcer patient can have. Some people don't even have ulcer from the beginning, but when they take all those sorry, what I mean, I'm speaking Yoruba right now, but what I mean is, like, when you go to the pharmacy, they'll just pour it together for you, and they pour all the painkiller meds there, the heavy strong ones. They don't ask you, they don't tell you, that's why it's not good to self-diagnose yourself. And even if you want to get medicine, get it from someone that actually have sense. I'm sorry, any small thing, you see people using diclofenac of 100 grams, they could just take 2 at the same time. Like, please, it's too much. Panadol extra, because Panadol extra, the extra in it means that caffeine is in it, right? So for me, I'll just say, just avoid the whole of Panadol extra, diclofenac, ibuprofen, aspirin. And I remember I said that paracetamol is your best friend. If not paracetamol, there's this other medication that is perfect for ulcer patients for pain, which is called Offensic. Offensic is like paracetamol but added with something else, but it's very, very safe for ulcer patients. Because some people will be like, paracetamol doesn't work for me anymore. You can get that. You could take any type of swallow that does not have cassava in it. There are a lot of things to eat. Just avoid cassava flakes, avoid gari. Most patients will come, they will tell you that they didn't take gari or eba, but at the end of the day, we narrow it down to the fact that they did. You cannot deceive us. You are just stressing yourself and you're causing pain for yourself. And what people don't know is that when you take good care of yourself, ulcer is something that actually heals. It heals, like, in a long time. It heals by itself if you avoid these things. And it also heals by taking something that I'm also going to tell you at the end of this video, right? So stay tuned. Energy drink, because the energy drink contains caffeine. The other type of food that you can have as an ulcer patient is coconut rice. Coconut rice has, because I mentioned earlier that you can actually take coconut. So I don't know, depends on where you're from in Nigeria, but where I'm from, we eat coconut rice and it's really nice. So you can have coconut rice as well. Also have the juice. I've said that before, like the coconut water. Your beans, you can't eat beans that's not peeled, because the shaft of the beans is actually acidic, so you have to peel that off. I know it sounds stressful, but this is how you do it, right? You just soak it overnight and you peel off the shaft in the morning. Olive oil is like the best for cooking. I know it's not really common to use olive oil to cook like a lot of things, but like if you could add that to your diet, it is perfect. It is very nice. You can have any other type of soup apart from egusi soup. Depends on where you're from and the type of food that you eat. But if you still have any questions, I'm available. You can ask me. So that's everything for the type of food that you can eat, even though I'm still going to tell you about the fastest way to heal like your ulcer. This cabbage. And what people don't know about cabbage is cabbage contains like a sulfur compound. I'm not going to start blowing grammar here, but I'll put the name on the screen. It contains sulfur compounds that actually helps to heal ulcers, destroy H. pylori. Do you see how amazing that is? There are a lot of ways that you can implement cabbage in your food. You have your salad. You can actually make cabbage juice. That is so nice. You could have it in the morning and at night. Take the juice, use the leaf to make a lot of things. You could be eating rice and just put like your salad beside it. Just make sure that cabbage is mostly in everything that you're gonna have. If you're the type of person that does not really like salad like that, then the juice is perfect for you. And if you don't feel like you want to take the juice, then salad is perfect for you. I don't think you get tired of it because it has no taste and it's just like you're just drinking water basically. So cabbage actually helps way faster to heal. Why I'm saying this, because it has actually helped a lot of people to heal from ulcer way faster. So that's something that I'm letting you guys on, telling you guys that cabbage works magic. Yeah, just don't cook it too much, because when you cook it too much, the benefits, the nutrients is out of it. So if you have ulcer, any type of ulcer, or you know someone that has it and has been struggling, because you're gonna get tired of taking omeprazole and everything and antacids and stuff. You're gonna get tired. I know you're gonna get tired. Just share this video to them and let them know that there are ways to heal the ulcer way faster. Thank you for watching to this time. I still remain your baby girl that's always gonna bring you good news on how to deal with stuff way easier. Thank you for watching. I really appreciate you guys for always being there, always sticking by me even when I get too busy and I forget about YouTube. I'm so sorry about that. Make sure you like if you've not still, subscribe, click on the notification button by the side to get notified anytime I drop a video. And from now I'd actually not mind you guys telling me the type of video you want me to do next, because I'm here to help in it. If this is your first time being on my channel, you're so welcome. If this is not, thank you guys for sticking by me. I love you guys so much, and I'll see you in my next video. Through kissing. So before you go on, but I'm just here to give you information. Alright? It's okay. Hi everyone, my name is Adex Omotola, or you can call me Adexi for short. I'm a medical doctor and a surgeon, and this page is basically about lifestyle in general. Now, this video was highly requested. I dropped a video a few months ago about the types of food to avoid when you have ulcer. I mean, I got emails, I got DMs, even under my comment section about people complaining. This is the same thing we get from patients in the hospital. Like, I'm in Nigeria currently. Patients are always complaining that, what are we supposed to eat then? You said we shouldn't eat this and eat that. What are we supposed to eat? That we are trying to starve them. Like, it's so funny, it's hilarious, right? So now, if you're wondering or you're curious about what to avoid and you've not seen my last video, you should probably check that out. You should definitely check that out before you watch this video, or you wait to the end of this video then you go check that out. So in my last video, I talked about like the types of ulcer, right? I mentioned that we have esophageal, we have gastric, and we have duodenal. So duodenal ulcer is usually at the first part of the small intestine, right? While the gastric ulcer is when you have like a sore in the lining of the stomach. I'm trying to tell you guys the difference so you know the type of ulcer that you have, right? Because everybody just thinks, oh, everybody says, I mean, I have ulcer, I have ulcer, I have ulcer. What type of ulcer do you have? You have to know as well. When you have duodenal ulcer, you notice that the pain that you feel gets relieved after you eat. While for gastric, it depends on what you eat, though, but the pain increases after you eat. For duodenal, you notice that you have mostly dark stool, and it's very common in male. But for gastric, there's always vomiting and weight loss. So basically, in all these things that I just said, you would feel pain. You would definitely feel pain, like a sharp pain, like a burning type of pain in your belly, most times in your navel, between your breastbone. When it's getting really serious, it radiates to the back. Today's video is going to be about the causes of ulcer. What actually causes ulcer? Because that is a very popular question as well. Wait. Hold on. If you've gotten to this part of this video and you've not liked yet, you've not subscribed, please. I mean, what are you waiting for? You're already interested. Make sure you subscribe, click on the notification button so you get notified any single time I post a video. I'm back right now, I promise you guys. I've missed you guys a lot. Drop a like, click on the like button, share it to your family, your friends, your bae and your boo. You know how it goes. Causes of ulcer, we have numerous causes of ulcer, okay, but there's one that's very, very common. Before we talk about that common one, the other causes are stress. I know some of you are like, stress, yes baby, stress, drinking of extremely hot beverages. Some of you just can't do to wait for your tea to get cold. You just like to be taking a hot thing. Understand, but take it easy. Painkillers, steroids, your ibuprofen, diclofenac, you know those ones that those pharmacy will just pack for you whenever you're feeling pain. Those ones. Drinking of too much caffeine can cause it as well. So what's the most common cause of ulcer? Helicobacter. Let's just call it H. pylori. That's too much grammar. H. pylori is the common cause of ulcer. Most of you should have heard of H. pylori, but if you've not, I mean, that's what you hear, right? It is mostly found in the stomach, but there are also ways that it's being spread. We're gonna get back to that later, okay? So in proliferation, the H. pylori, which is helical in shape, I'll put the picture for you in the screen, causes damages to the mucous lining of the stomach. But wait, H. pylori is not actually pathogenic. I mean, most of the time it's not pathogenic. I'm sure most of you already know that you have acid in your stomach. We have acid in our stomach, yes. That's what makes us helps us to digest our food. So when that acid becomes low, or when it's not enough, right, the pH balance increases, which is now alkaline. So in that action, the H. pylori now overgrows, and when it does that, it causes ulcer, because now it is pathogenic because of the decrease in the acid that's in the stomach. Do you understand me? Basically, what I'm trying to say is ulcer was created by the lack of acid in the stomach, not by too much acid, because a lot of people get this thing misconstrued, and we're just trying to pass good information so we don't get confused here. All right, how can H. pylori be spread? It can be spread from person to another. For example, like a contaminated food, your utensils, vomiting, stool, saliva, through kissing and oral sex. So before you go on, I know this is really hard because you can't be asking people that do you have ulcer before I kiss you, before we, but I'm just here to give you information. Right? It's okay. Now that we all understand what ulcer is and what H. pylori is, and I'm sure that I've passed enough information, let's now go to the food, like the main reason of this video, the type of food that you can eat so you don't get confused.
5 minutes later.
All those things to the bin. Get it from someone that actually have sense. I'm sorry. Because most people are like, so if you go to party now, we're not going to be able to eat. I'm always wondering, people just like, there's nothing to eat anymore. There's nothing to eat anymore. There are lots of things to eat. You cannot deceive us. You are just stressing yourself and you're causing pain for yourself. Hi guys, it's Pink October, meaning it's National Breast Cancer Awareness Month. It's an annual campaign to raise awareness about breast cancer, which means to raise awareness about the signs and symptoms, the risk factors, how to avoid the risk factors, and the treatments. Everyone with breast is at risk of developing breast cancer. And when I mean everyone, I mean both male and female. Though most breast cancer occurs in women that are above 50 years old, but in some rare cases, there are things that will increase the chance of young women to have breast cancer, which is usually called the early onset breast cancer. So you see, it's important for you to know the risk factors. And when I mean risk factors, Risk factors are usually the causes. So it can help you to prevent it, can help you to plan, and it can help you to catch it early. Because when you do this, there's a 98% chance of passing the 5-year survival rate with early diagnosis. So let's go to the signs and symptoms, shall we? When we're talking about breast cancer, there's some certain things that you should look out for. Number one is the appearance. Appearance in size. Is it different from the way it was before? Has it increased? Is there redness on the breast? Is there thickening? Is it thick? Or there are some certain parts on the breast that are thick? Are the veins on the breast popping out than usual? And are there irritation as well? Number two, are there any lump in the breast that feels different from the other, or are there lump in the both breasts? Is there any swelling or thickening? And when I mean swelling, I mean are there any swelling under the arm and the armpit area or around the collarbone, which is around this area? Number three is pain or discomfort around the breast, either of the breast, okay? It's either it's a pain that has been there before, has been coming and it's been going, or it's a new pain. The last sign is nipple changes. There's going to be changes in the nipple. For example, there's going to be change in shape. It's going to be bleeding or discharge from the nipple. The nipple is going to be inverted. It's going to be, for example, like a dimple. It's going to be like inside. It's going to like go inward. Do you understand? You can see why monthly self-examination is extremely important. Emphasis on the extremely, okay? There's an examination that I want you to know. It's actually originated from Lebanon, and it's the best way for you to check yourself at home. First, you press in circles, then you press in lines. Lastly, you gently pinch as well. So that examination is called the bread examination. The other way to check for breast cancer is mammogram. Mammogram is like an x-ray, and for that, of course, you have to go to the hospital, and that's the best way actually to check for breast cancer. Let's talk about the early onset breast cancer, and these are for the people that are lower than the age of 45, okay? These are the things that put you on the higher risk of having breast cancer. One is it's often hereditary, and when I say hereditary, most people think that's just from the maternal side. No, both paternal and maternal, especially if you've had one or more relatives that has had breast cancer or ovarian cancer in the past, okay? Having your menstruation before the age of 12 is also going to put you on a higher risk of having breast cancer. Next thing that puts you on a higher risk of having breast cancer is having a dense breast. I mean a breast that has more connective tissue than fatty tissue. So number one, it's even hard to find any tumor. And when it's hard to find any tumor, you know that it is difficult to treat. And when they find it later on, it's always aggressive. Previous history of breast cancer, because when you've had breast cancer in the past, you're most likely to have breast cancer the second time. Also, if you've had any form of radiation therapy to your chest or your breast, you are also on the higher side of having breast cancer later in the future, especially if you had that therapy before the age of 30. The craziest thing now is some women would get breast cancer without any of these risk factors, and the fact that you might fall under any of these risk factors does not mean that you're even going to get breast cancer. For males, the risk factors are: number one, there's a rare genetic condition in which the body of the male has an extra X chromosome. So now in this case, the body actually makes more estrogen instead of androgen. That's supposed to be for the male sex characters, right? So in that case, there's going to be risk of having breast cancer. Cirrhosis of the liver, which can lead to lower androgen levels and increases the estrogen levels in the body of the male, and that is liver damage. Another risk factors for male is obesity, and the last one is some certain surgeries that have to do with the removal of the testicles, probably like injury or swelling that has to lead to the removal of the testicles. And the removal of the testicles can increase the risk of breast cancer. So enough of all these risk factors, what can cause it, symptoms, sign, all of that. Let's go to the good news, okay? How can you prevent this from happening? How can you lower the risk of you having breast cancer later in the future? One, keeping a healthy weight. I know you guys are already tired of what I say, exercise. Just keep a healthy weight. Exercise regularly. I'm not saying you should go and overdo all the things, but just make sure that you're not too fast. You know when you feel healthy, you know when your body is healthy. The other steps to prevent breast cancer or to reduce the risk of having breast cancer later in the future is to cut back on your intake of alcohol, or if you can't avoid alcohol totally, just drink in moderation. Make sure you get 7 to more hours of sleep at night. Breastfeed your children if you can. If you are on any hormonal pills, let your doctors know, because there are some contraceptive pills that have been found to increase the risk of breast cancer as well. And finally, make sure you have your first child before the age of 30. We have 5 different types of treatment for breast cancer. The first, which is hormonal, chemotherapy, radiation therapy, surgery, and biological therapy. For surgery, it's just simply how it sounds, the removal of the cancerous tissue. For chemotherapy, it's using medication, could either be oral or IV, to treat breast cancer. For radiational, it's using high energy rays to destroy the cancerous cell. For hormonal therapy, it's blocking cancer cells from getting the hormones that they need to grow. And for biological therapy, finally, it's working with your body immune system to help it fight against cancer cells. For the treatment of breast cancer, doctors from different specialties often come together to work: the surgeons, the medical oncologists, and the radiation oncologist. My name is Adex Omotola. Don't forget to stay hydrated, and thank you for watching.
Hello everyone, my name is Adex Omotola. In today's video, I'm going to be talking about hypertension, also known as high blood pressure. So we are going to be talking about the causes, the symptoms, the complications, and the treatment. If you're interested in this video, keep watching. So in this video, we're going to be talking about high blood pressure, which also stands for hypertension. Hyper means high and tension means pressure, so high pressure. So of course, before we start this video, I want you guys to know the definition of hypertension. And it's a condition in which the force of the blood against the artery wall is too high, causing the blood pressure readings of more than 140 over 90 millimeter mercury, and it's considered severe if the pressure is above 180 over 120 millimeter mercury. Classification of hypertension: first of all, we need to know the normal blood pressure, which is 120 over 80, the systolic being 120 and the diastolic being 80 millimeter mercury. So let's talk about the pre-hypertension. So pre-hypertension is 120 to 140 over 80 to 90. So let's just say it's 140 over 90 millimeter mercury for pre-hypertension. Pre-hypertension means not normal, at the same time not hypertensive. It just means that there's a slight chance in you getting hypertension, so it's better to start early lifestyle management. There are 2 stages of hypertension, stage 1 and stage 2. Stage 1 hypertension range is 140 to 160 over 90 to 100, which is 160 over 100 for stage 1 hypertension, and stage 2 hypertension is greater than 160 over greater than 100, so that's 180 over 120 for stage 2 hypertension. I'm sure you guys have heard of hypertensive urgency. Well, if you've not, it is when your blood pressure range is 180 over 120 or greater than that without any symptoms. If there's a decrease in the systolic pressure, that means there's blood loss or there's dehydration. And if there's an increase in the diastolic pressure, it means the blood pressure is increased when it's supposed to be decreased. Most people with hypertension are unaware of the problem because It has no warning signs or symptoms. For this reason, it's essential that blood pressure is measured regularly. Hypertension is mostly called a silent killer, but when symptoms do occur, they can include early morning headaches, nosebleeds, irregular heart rhythms, vision changes, and buzzing in the ear. Severe hypertension can cause fatigue, nausea, vomiting, confusion, anxiety, chest pain, and muscle tremors. Treatment of hypertension. We have lifestyle changes, which is the best treatment so far, which starts with eating healthier diet or DASH diet with less salt, exercising regularly, taking medications that helps with the low blood pressure or high blood pressure, quit smoking, quit drinking, stress management, and cut back on caffeine. Meditation and relaxation can also help, and this is the best treatment so far because you don't have to deal with any side effects, unlike the drugs, which we are going to talk about very soon. The second treatment for high blood pressure are the medications. Let's talk about classification of drugs used for high blood pressure. First, we'll have ACE inhibitors, diuretics, beta blockers, and calcium channel blockers. The drugs under these groups are going to be listed below, but that's not what we're going to talk about today because I need to tell you the group of people that respond well to these drugs. Under the ACE inhibitors and beta blockers, there's been improved in survival in whites and elderly whites, and under calcium channel blockers and diuretics, they've been improved in survival in African Americans and elderly African Americans. So we're going to talk about the side effects of each classification of drugs. To make it simple for everyone, we're going to make a table. So the first table is going to be ACE inhibitors, the second table is going to be beta blockers, third is going to be calcium channel blockers, and the fourth table is going to be diuretics. Mind you, this is just all the side effects of each drugs. The side effects for ACE inhibitors, you would have angioedema, which is swelling of the tongue and the neck. We're going to have cough, that shows like 30% mainly in all patients that use the drugs. There is going to be hyperkalemia. For beta blockers, you're going to have decrease of heart rate, decrease of blood pressure, increase in lipids and in cholesterol, increase in depression, increase in asthma, increase in COPD, increase in potassium. For calcium channel blockers, you're going to have increase in the heart rate, edema, which means swelling, constipation, and heart failure. For diuretics, you'd find decrease in potassium, increase in calcium, increase in uric acid, increase in lipids, increase in glucose, which is bad for diabetic patients. There's going to be increase in creatine, which causes renal failure. So these are all the side effects of these drugs, and that's why I said lifestyle changes is the best treatment for high blood pressure. Looking at all the side effects, you'd see that there are some type of patients that can be offered this drug. For example, a patient with gout can be offered diuretics because of the increase in uric acid, and a patient with kidney stone can be offered diuretic as well because of the increase in calcium. The causes of high blood pressure can be divided into two. The first one being the primary and the second being secondary. So under the primary, you can have renal artery stenosis, polycystic kidney disease, endocrine disease such as hyperaldosteronism, Cushing syndrome, pheochromatoma, hyperthyroidism, and acromegaly. There are also some medications that can cause high blood pressure, such as oral contraceptives, decongestant, antidepressant, non-steroid anti-inflammatory drugs. We have pain relievers such as ibuprofen and fever reducers, also cocaine. What are the risk factors of hypertension? When I say risk factor, I mean the things that increase a person's chance of developing a particular disease. Under the risk factors, it's divided into two, called modifiable risk factors and non-modifiable risk factors. Under the modifiable risk factors, we'll have unhealthy diet, which is excessive salt consumption, a diet high in saturated fats and trans fat, low intake of fruits and vegetables, physical inactivity, consumption of tobacco and alcohol, and being overweight or obese. Under the non-modifiable risk factor, we have family history of hypertension, age over 65 years, and coexisting diseases such as diabetes or kidney disease. What are the complications of uncontrolled hypertension? There are several complications of hypertension that also affect the vascular system, which causes organ damage such as hemorrhagic stroke, ischemic stroke, coronary artery diseases, left ventricular hypertrophy, abdominal aortic aneurysm, aortic dissection, peripheral artery disease, and nephrosclerosis. Hypertension can cause serious damage to the heart, causing excessive pressure that can harden the arteries, decreasing the flow of blood and oxygen to the heart. This elevates pressure and reduces blood flow, which can cause chest pain, which is also called angina, heart attack, which occurs when the blood supply to the heart is blocked and heart muscle cell dies from lack of oxygen, heart failure, which occurs when the heart cannot pump enough blood and oxygen to vital body organs. We have irregular heartbeats, which can lead to sudden death. Sometimes you just hear stories of people just falling down and dying. But because we're in Africa, people be like, it is spiritual. Everything is not spiritual. Everything is not from a village. It could be this, all this. If you don't know that you are a known hypertensive, these things can definitely happen to you. I guess I was able to help with this video, even if it wasn't long as the rest of my videos. The point is to get the message across and we just learn. Yeah, so you don't miss any of this. Like, how would you want to miss this? How? Just tell me. How? Okay, subscribe, click on the notification button, give it a thumbs up, share this video to your friends, family, baby. Let them know everything about hypertension. If they already know, still send them this video anyways. And drop a comment down below, let me know what you think. Anything to add to this, add it right there. If there's any questions, drop it down there. And I'll see you in my next video. Hello everybody, welcome to Adex's TV. My name is Adex Omotola. I'm back on another medical series for you guys. If you've not watched my last video about hypertension, you should go watch it. And under the comment section, someone asked me to do a video about diabetes, hence this video. So in this video, we're going to be talking about diabetes. That's the topic of today. It can also be called diabetes mellitus. First of all, what is diabetes? Diabetes is the disorder of metabolism, or the increase of blood glucose in the body over a prolonged period of time. Most of the food we eat is burned into glucose or sugar for our bodies to use for energy. The pancreas, an organ that lies near to the stomach, makes the hormone called insulin to help glucose get into cells of our body. When you have diabetes, your body either doesn't make enough insulin or can't use its own insulin as well as it should. It causes sugar to build up in your body, and this is why many people refer to diabetes as sugar. You need to know that there are 3 types of diabetes, being type 1, previously called insulin-dependent diabetes mellitus, and type 2, and gestational diabetes. So what is type 1 diabetes? It's an autoimmune disease in which the immune system attacks and destroys the insulin-producing cells. And in this type of diabetes, you need insulin to live. Or juvenile onset diabetes. Type 1 diabetes may account for 5% or 10% of all diagnosed cause of diabetes. Risk factors are less defined for type 1 diabetes than the type 2 diabetes, but autoimmune, genetic, and environmental factors are involved in the development of this type of diabetes.
It's mostly common in kids and young adults. So that's for type 1 diabetes. So let's talk about type 2 diabetes,
which is NIDDM, or adult onset diabetes.
It's when the pancreas doesn't produce enough insulin for the body, or the cells doesn't respond well to the insulin produced. You need to know that type 2 diabetes is usually associated with older age, obesity, family history,
prior history of gestational diabetes, impaired glucose tolerance, physical inactivity, and race, which is African American, Hispanic / Latino Americans, American Indians, and some Asian Americans. And Pacific Islanders are at partially high risk of type 2 diabetes. The causes are usually multifractional, and more than one diabetes cause is involved.
And physical inactivity, which causes slow healing wounds.
Type 2 diabetes may account for about 90% to 95%.
So let's talk about the gestational diabetes. From gestational, you should know that it's about pregnancy, right? So it occurs in late pregnancies but disappears after delivery. And you are prone to have type 2 diabetes later in the future, like from 5 to 10 years. So if you already have gestational diabetes, you should watch the way you eat, so you should know to avoid diabetes in the future.
Other specific types of diabetes result from specific genetic syndromes, surgery, drugs, malnutrition, infection, and other illnesses.
So what are the symptoms of diabetes? These are the symptoms. You have polyuria, which is increase in urine, polydipsia, increase in thirst, polyphagia, that means increase in hunger, then weight loss, tiredness,
very dry skin, sores, more infection than usual, sometimes nausea, vomiting, or stomach pain,
and blood vision. How to manage diabetes? First of all, you have to exercise regularly, physical activity, then followed by diet. If you have to eat healthy with less sugar, obviously, then you have to keep tabs or keep notice of your blood pressure, your blood sugar, and your cholesterol, right? So let's go to the medication. Obviously, we need insulin, right?
Diet control, exercises, home blood glucose testing, oral medication, or insulin.
What are the complications of diabetes? We have the acute and we have chronic. Under acute, we have diabetic ketoacidosis, which means life-threatening diabetic coma. That's diabetic ketoacidosis. You have hyperglycemic state, there's death, there's hyperosmolar, right? And for the chronic complications, we have cardiovascular disease, we have stroke, we have amputation, there's damage to the eye, which is blindness, and foot ulcers. So that's everything about diabetes, the definition, the types, the complications, and the treatments, also the medication. So enough of hyperglycemia, which means diabetes, of course. Hyper means high, glycemia means sugar. So what if you have low blood sugar, which is hypoglycemia? You would find that the person is nervous, confused, and mostly shaking, right? And if it gets lower than that, that's where you see some patients fainting from having low blood sugar.
Death rates of blacks with diabetes are 25% higher than of whites. There is no cure for diabetes, but it can go into remission, and people can manage it with medications and lifestyle changes. What food can reverse diabetes? Desserts, sweets, pastries, bread, chips, crackers, and pastas. Beans, dairy, tuna, fish, salmon, barley, oats, berries, grains, walnuts, dark chocolate, and peanut butter.
So that's the end of this video, guys. I hope you enjoyed this video. Make sure you click on the like button, subscribe if you've not. If you have, thank you so much for subscribing. Make sure you click on the notification button beside the subscribe button so you get notified anytime I post any video. And more medical videos are coming up soon. Watch out and stay blessed.